It's Melissa's birthday today.
Hi! We got sticky beans.
We made our best in the beans.
Made a mess of beans. But I love the color pink and purple. Thank you, Micah, for giving me flowers.
You decorated all day today.
Yeah, but it's not that much. Really simple. Got some.
Waiting for our friends to come. And I have been studying for my integrated medicine boards in between all this. And Melissa, let's ask you some questions. You want to take your integrated medicine boards too, and then your functional medicine?
I do. It's been on my mind for months and over a year.
All right, so you did lifestyle medicine, integrative psychiatry. What's next?
Ooh, yeah, integrative, a real deal.
Take the boards just like me?
Yeah.
And then what's after that?
Functional, more to come, right?
Well, officially get certified, even though you're doing it already.
Yeah, already doing it. Love the learning. Love keeping up with the science. It's not that easy. You gotta keep up, stay up to date, and have a good time.
Oh my gosh, and then, well, we looked at your integrated medicine boards, not boards, but the integrated medicine fellowship, I think AIHM.
Yeah.
It was, what, 26,000?
Oh, so much money. But worth the investment, right? You're gonna help a lot of people.
So, yeah, I guess that's what's coming up for you after this birthday.
After this birthday, for real. Gotta make time.
So it's both Melissa's and Jacqueline's birthday coming up 4 days apart.
Okay, happy birthday.
Happy birthday to you. Happy birthday to you.
Okay.
Happy birthday, dear you. Happy birthday, dear Melissa and Jacqueline.
Everyone gets this.
Happy birthday to you. Yay.
Oh, the candle. Yay. She's joining. Family and friends here. This is a special time to be together.
Yay! I am studying for my integrated medicine boards and it's driving me crazy. I am studying every single system out there, not just rheumatology, not just even the immune system, but studying a bunch of things that I hardly see, such as OB-GYN stuff, integrative approach to OB-GYN, integrative approach to metabolic disorders, learn about different supplements and herbs that are so hard to memorize. I just want this test to be over. Oh my gosh. Why do I do this to myself? This is gonna be my 4th board certification if I pass this, and let's hope I do. Oh my gosh, I'm nervous. The test is coming up on Monday. So I'm answering questions about labor induction and which herbs can help with labor induction. Oh my gosh. OB-GYN was my least favorite topic during medical school. Let's see here. With respect to labor induction and post-stage pregnancy. God. Black cohosh, blue cohosh. I didn't know there was a difference between the two. Oh God. Alright, let's talk about things that I will probably not use in my practice. So the answer to respect to labor induction in pregnancy, you can use membrane sweeping at 38 weeks. Amazing. I probably will not help my patients with this. I don't do OB-GYN. Oh God. So that's what medical school was. A lot of learning different things that I didn't use. And in integrative medicine, I am learning this, doing the same thing, learning things that, might help me one day, but a lot of things that might not help me, such as helping patients in labor. Might help my wife in labor, but probably not the patients because I'm not going to be there during labor. And in this book I'm reading on the OB-GYN section, talks about estrogen dominant. This is the first time I've seen the official definition. So pretty much estrogen dominance is when there are stronger estrogen effects that can be balanced It applies to conditions with stronger estrogen effects that can be balanced with existing progesterone. Estrogen dominance can also manifest through imbalanced estrogen metabolism, and fibroids are associated with estrogen dominance. Autoimmune diseases are fibrocystic breast problems, gallbladder disease, infertility, PCOS, premenstrual syndrome as well. Let's talk about the factors that promote estrogen dominance, and that includes high glycemic index foods, hormone-rich meats, poultry, and dairy, lots of saturated fat, gluten-containing grains, intestinal dysbiosis, lots of sugar, insulin resistance, environmental issues, environmental toxins, xenobiotics, PCBs, dioxins, heavy metals, birth control, and hormone replacement pills. Stress does it, and also reduced estrogen detoxification can lead to estrogen dominance. So all these factors can lead to estrogen dominance. Very, very interesting. I'm tired of studying.
I'm not tired.
I'm tired of studying.
I want to study more.
What are you gonna study?
I'm going to study a lot of things like how to rest.
Can you take my boards for me?
I want to. I'm enjoying my flowers today.
It's Melissa's birthday coming up, and she just had her friends over, and she got lots of gifts. And her birthday, oh, there's Cookie. Cookie, let's go running.
I'm going to run.
Cookie, let's go running, Cookie.
Chill too.
Oh my gosh. Let me show you guys the book that I'm reading from. It's also in a electronic format. Where is it? My Rakel book here. Found it. So this is the textbook that I'm reading from. Rakel 5th edition integrative medicine. You see it's like 1,000 pages. They say that we have to read this whole thing, and they said that a lot of the test questions, the ideas can be tested from this. I'm also studying from my University of Arizona's Integrative Medicine Fellowship content as well. So lots of studying coming from GI, cardiology, endocrinology, diabetes, thyroid, OB-GYN stuff. Learning a little bit about Ayurveda, homeopathy, acupuncture points, a little bit of each thing. It'll go into this test, so I don't think I'm prepared yet. All right, so we got more studying here. Right now I'm learning about men's health and learning about how to treat BPH, which is enlarged prostate, with supplements, which include saw palmetto, beta cytosterol, and stinging nettle, just one of them. And also you can treat bacterial prostatitis, looks like, with integrative approaches as well. But it looks like they use mind body medicine, all these other things, and botanicals, quercetin, saw palmetto, again, ryegrass pollen extract. I've never used these supplements before. You can use them to help with the prostatitis as well, which is bacterial infection of the prostate. So I'm gonna write this down here. So the test is in a couple days, and I am not ready. I mean, I am not nervous about this test because my career is not on the line. But in the past, you know, when I took step 1, the boards, I mean, I was nervous for these tests because if you fail multiple times, you're done. You can't even be a doctor anymore. So I am, you know, just soaking this all in. Is what I've always wanted to learn in medical school, supplements and different ways to treat patients besides medications. But they just never taught this stuff during medical school. They never taught nutrition, and that's something that I was really upset about. Luckily, I went through this fellowship. Now I can take the boards for this. If I didn't get the scholarship for my integrated medicine fellowship, it would have been $40,000 for this. I got the only rheumatology scholarship. Somehow rheumatology is one of the few specialties that they give scholarships to, and I got it. Thank God I got lucky. But this is something that, you know, I am really appreciating learning. So let's see what else I can learn about. Okay, so you probably have heard that cranberries can help with UTI symptoms, and I find that that's not a myth. That's actually true. And I'll talk more about that in a bit. But one thing that I just learned is that cranberries, and cranberry juice can also help with patients with prostatitis, infections or inflammation of the prostate, which could include infections as well. So that's really interesting, is because it can have anti-inflammatory properties. That's what they theorize. All right, so today is Melissa's birthday. Happy birthday, Melissa. Taking a break from studying for my boards.
Yeah.
And we're gonna go eat some vegan sushi and ramen in Huntington Beach.
Yeah, I'm so excited. There's flowers out here.
All right.
Love finding new ways to eat healthy.
All right, let's see what they have. Let's see what's on the menu.
Yeah, I'm excited.
All right. Are you ready for some vegan sushi and ramen?
Oh yeah.
We try to eat as plant-based as much as possible. We're not always perfect, but we try our best. All right, let's see what we're eating for Melissa's birthday. There's Melissa taking her own selfie. And we got miso vegan ramen. We got shishito pepper or tempura. And we got 2 more sushis coming out. Can't wait to show you guys. The sushis just came out. What do we get?
Oh my goodness. My favorite, a mixture of different ones, which is like a tuna tomato base. Bouldering Nirvana. And this is a strawberry delight. Look at this. Brilliant. All plant-based. I know.
All plant-based. We try our best. We're not perfect. Sometimes we don't eat completely vegan, but we try our best.
All processed, but not all processed.
All right. Can't wait. Taking a break from studying. So this is what we do when the ramen is too salty at restaurants. What we do. So the broth is way too salty, which it usually is. So we add a bunch of hot water and we get multiple meals out of it. Multiple servings. That's what we do.
That's what we do. It's the way where we don't get all icky inside. They're too salty, too oily.
Everybody, we're at the Hoag Hospital event, Doctor's Day Appreciation, and we're at a really fancy hotel in Huntington Beach, and there's Melissa on the phone with her patient. Let me show you guys this hotel. It's so cool. So, how was the Hoag Doctor's Day?
It's cool to have Doctor's Day with colleagues and the reunion of our previous...
We saw a lot of our friends here from med school and residency, so it was fun after our work play. All right, last night was really fun going to the Hoag Hospital event, but today I'm studying again. I'm about to take my boards in 2 days, and just going through all the systems. Just took my practice test to help refresh my memory. So learn about ways to taper off PPIs, learn how to treat IBS, enlarged prostates with supplements and herbs, and how to help with nausea and vomiting with herbs. And there's so many things you can do with herbs and supplements. It's so fun learning about this stuff, and also including mind body medicine. But now I'm gonna go run, Cookie my dog, and then I'm gonna go learn some more and tell you guys some more facts on some herbs and supplements for integrative medicine. So I'm taking a break from studying. We're about to go see a house. We just almost got a place, so we're gonna check it out, and we're not gonna show you guys just yet, but we're gonna take a look, and then I'm gonna have to study all my integrative medicine stuff afterwards. So stay tuned. Maybe we'll show you guys our house one of these days. But yeah, we'll catch you later.
Hi guys, so I'm taking over Micah's vlog.
All right, we're gonna play a game.
What's the game, Micah?
We're gonna play a game. I'm gonna ask you questions that on things I learned on some kinds of herbs, and you have to try to answer the question.
Okay, pop quiz.
Okay, pop quiz. What can you use for chasteberry?
Chasteberry, oh, that's great for hot flashes and possibly even menopause.
Are you sure?
Yeah.
Is it?
I thought. Is it?
I thought it's for PMS.
Well, that too. It's both. It
It's
regulates
both.
the
Okay.
hormones. Ha.
How about black
Both.
cohosh?
Same thing. That's for menopause. And
How do you know this stuff?
come on, I'm a family medicine. I do women's health.
Okay, fine. Another one.
Okay.
Myth or fact?
All right. True or false?
Cranberry juice can help prevent UTI and treat UTIs.
Great question. Sounds too good to be true. So I would probably say no.
It's fact.
Ah, I knew
Yes,
it.
it's fact. It's
Okay,
fact.
okay.
So cranberry juice. I don't remember.
Is there a good study,
cranberries. Cranberry. There's a herb name for it. I don't remember. But
Well, it depends how
cranberries-
potent it is,
Yeah,
right?
cranberry juice or cranberry
I know.
supplements. Do you know how it works though?
Okay, well, I knew that was right. That's what I tell my patients, but then you tricked me. But okay, fine.
So it can help prevent the bacteria from binding to the epithelium of the bladder.
Oh,
That's why I'm pretty sure.
wow. So explain that in normal terms.
So pretty much you can prevent the bacteria from binding to the layer of the bladder,
The layers of the bladder, right? Epithelium means like
the other
the
layer,
tissues.
the tissue.
Yeah.
So that's how it works. And then I think D-mannose you can also use it for bladder as well. But all right.
Yes, so that's sometimes you can find this over the counter, but use it with caution with a medical professional. By the way.
Another one is saw palmetto. What do you use it for?
You can use it to help with ED and libido.
What else?
You can use it for.
Is it really? ED for really?
Mm-hmm.
Okay. Well, there's other thing I was thinking about.
Okay, we're too smart.
Prostate.
Yeah, definitely it's for prostate
Benign
health.
prostate hyperplasia.
Yeah.
Okay.
Fact
Licorice.
check.
Licorice. What is it good for?
It's good for. I know. It's for gut health. It helps with the digestive tract for sometimes people with reflux too.
Yes. Reflux. Do you give DGL or GL? Do you give the deglycerated
DGL?
licorice, or do you give the glyceride type?
You give the DGL one.
Okay. What's the difference?
Deglyceride.
Okay.
Tell me,
So
what
the-
is it?
So the glyceride version
Uh-huh.
doesn't have the mineralocorticoid action of the glyceride version.
Oh,
So
the
that's why,
mineralocorticoid.
because if you give the regular one, the glyceride licorice, you'll get the hypokalemia, so low potassium. You'll get the high blood pressure from it.
Yeah, so this is legit, right? We gotta know the side effects. We gotta know the safety profile. We're not just throwing herbs and supplements. You can't just do this because people can get hospitalized.
Yeah. Okay. So that's why. But you give the GL for other reasons. The glyceride licorice for other reasons. Which I don't remember off the top of my head, but that's one way you can help increase cortisol. I think the half-life or something is by giving the licorice.
Give more, so you have more sense of energy,
Yes.
less fatigue.
Yes. Let's go down the system. So we're talking about
Okay.
OB-GYN stuff. Psych.
Okay, mental health, my fave. Let's
Okay,
go.
let's go. Valerian root, what do you use it for?
That's for sleep, for insomnia.
Sleep and
Very
insomnia.
Mm-hmm.
And then you also use it for anxiety. Sammy, what do you use it for?
Anxiety.
Okay. And do you make it in your body?
Yes, it's a precursor.
Okay.
Mm-hmm.
Is it low in depression?
Yes.
That's why you give SAMe for depression patients as a supplement.
Mm-hmm.
SAMe is also used for what in musculoskeletal conditions?
Oh, that's
What's
a
their
good one.
elements for? You can use it for osteoarthritis. There is data for it.
Cool! I like that one.
Okay, next. What other questions are there?
Psych.
Okay, psych.
5-HTP, what does it do?
5-HTP, I don't know what it is. You know it. Tryptophan.
Tryptophan, precursor, right? To serotonin, dopamine, norepinephrine, helps boost your mental health, your mood, cognition.
Okay. All right. Cardiovascular.
All right, hearts,
Hawthorne. What do you use it for?
blood pressure, high cholesterol.
You do?
Ooh, what is
Well, you were
it?
guessing. You didn't know, right? You
Well,
were
I
guessing.
know it was along that.
Yes.
So tell me.
Well, that's because it's cardiovascular. Of course, you're gonna say something.
No, I've used it before.
Okay, so you use it for heart failure. Authorized for heart failure. What is the potential side effect you need to look out for?
Oh, I don't know.
Orthostatic hypotension.
Orthostatic hypotension.
Hypotension.
So that's when your blood pressure drops.
Okay. L-citrulline and L-arginine are used for what?
L-citrulline and what?
L-arginine.
Oh, they're amino acids.
Yes.
I don't know. Don't know. Blood pressure? I don't know.
So they are used for blood pressure.
Yes, right.
Yes. But what's the
What
potential
is
side
that?
effect you need to look out for?
Kidney issues.
It thins out the blood.
Blood.
So coenzyme Q10. So I'm gonna name 4 different supplements.
Mm-hmm.
You tell me which one doesn't have antiplatelet action.
Okay, go.
Magnesium, L-citrulline, coenzyme Q10, and garlic. Which one out of the 4 does not have platelet action?
What was the second one?
So magnesium, L-arginine, coenzyme
this is
Q10,
hard.
or garlic.
Oh, I think it's magnesium.
Magnesium doesn't have it. Garlic has can thin out the blood a little bit. Coenzyme Q10 can do that too. Okay.
So I guess right?
Yes.
Well, I knew it.
Yes.
'Cause
All
I
right.
process elimination.
Okay. So
tell me.
next one. Let's talk about
I love
does yeast rice,
Okay.
you know, that's used for in place of statins sometimes.
Mm-hmm.
Does it have
cholesterol.
evidence for less myopathy?
Yeah.
So myopathy is less muscle aches, because statins can have muscle aches as a side effect.
Yes, it's a good alternative.
Does it have less chance of that?
Yeah.
Are you sure?
Yeah.
Oh, you're right. Yes. Okay.
I like
Next
that.
one.
So I've only gotten one wrong.
Yeah. So if you're on statin therapy,
Okay.
what supplement should you be on?
Quantum Q10.
All right, that's right. Because why?
Because of the myopathy.
Well,
and
The heart has a
the
lot
membrane.
of. The heart's like holds a lot of Q10.
right. It's
and,
the mitochondria.
statins, yeah, exactly.
It depletes them.
Yeah. Okay.
Oop.
Next one.
Yep.
Let's
see this angle. What is this angle?
Is there evidence of turmeric for inflammatory bowel disease?
IBD?
Yes, you're right. Next one. IBS. Do you use soluble fiber or insoluble fiber?
Insoluble or soluble?
I think it's insoluble. Yeah. All right.
This is fun. All right.
Well,
Next
well,
time.
well, we're gonna record more in a bit.
We're here, so
All right.
we're gonna check this out.
All right.
Bye.
I finally took my exam yesterday, and it was very, very hard. There were questions on there that I didn't expect. A lot of what if questions. Some questions on homeopathy, Ayurveda. Definitely lots of questions on supplements and herbs. So we'll see how I do. Maybe I'll pass. Maybe I fail. We'll see.